Today's topic of discussion glucose tolerant test. What is glucose tolerant test? Ability of a person to metabolize a given load of glucose, okay, is referred to glucose tolerance. We will give glucose, how it will metabolize the glucose. That ability of a person to metabolize the glucose referred to as glucose tolerance test. This glucose tolerant test having two major category: oral glucose tolerance and intravenous. This oral glucose tolerance further classified into classical oral glucose tolerance and modern or mini oral glucose tolerant test. Then indication: what are the condition we want to check blood glucose level, whether the patient having diabetic mellitus condition or excessive weight gain or BMI rate more than 25 during pregnancy period, past history of baby, the baby weight more than 4 kg or abortion, miscarriage, or additional risk factor like high blood pressure, sanitary lifestyle. Then history of PCOS, polycystic ovary syndrome. Then high cholesterol level, high history of heart disease or close relative parent having diabetic mellitus, means we want to check glucose level. So that time we will do this oral glucose tolerant test. Whether we have diabetic condition, over excessive weight gain, BMI rate more than baby weight more than 4 kg, miscarriage, high blood pressure time, sanitary lifestyle, then high PCOS, cholesterol level, heart disease, that time we want to take. Next, how to prepare our patient for OGTT, good carbohydrate diet for 3 days. Okay, before test, 3 days we will take good carbohydrate food. Then avoid drugs. Okay, we are taking any drugs, means we will avoid for 2 days. Then avoid heavy exercise on previous day. Then should not take food after. Here 12-hour fasting is important one. Okay, 12-hour fasting. Today night PM 8 PM means next day night morning 8 AM only we collected sample. So 12-hour fasting is essential one. They don't eat anything in that night time. Then should remain in hospital during the waiting period of 2 hours. After glucose load we will wait for 2 hours. At that time we never do any exercise. So these are the instruction we want to inform our patient. Avoid drugs, avoid exercise, fasting 12 hours. Then before 3 days we will take good carbohydrate food. Then during waiting hours we never do any exercise. Next one is procedure methodology. Next day morning, okay, 8 night 8 p.m we eaten. Then 12-hour fasting. Next day 8 a.m we collected blood sample. Okay, collecting blood sample, that one is the 0 hour. In the case of adult means 75 gram glucose we will take, add with 250 to 300 ml of water. We will inform our patient to drink slowly, otherwise it will cause us vomiting. So next day morning collected sample 0 hour, 75 gram glucose mixed with 300 ml of water. Drink slowly, it will take 5 minutes. So in the case of children means 1.75 gram per kg body weight. Then uh, next sample should be collected 2 hours post glucose. Okay, after glucose load, no, 2 hour we will wait, then only we will collect next sample. In the case of classical OGTT sample, collected at half an hour interval for the next 2 hours. Okay, next 2 hours after that only half an hour interval we collected the sample. Urine sample also we must collect for qualitative purpose. Why means normal person urine don't have glucose. In the case of this patient urine having glucose, means they have glucose urea condition, so we want to check, so we collected urine sample also. So next diagnostic criteria for diabetic mellitus: fasting less than 110 mg per deciliter, Criteria for diagnostic diabetes more than 126 mg per deciliter. Criteria for diagnostic impaired glucose tolerance 110 to 126 mg per deciliter. Then after 1 hour glucose peak, okay, after 1 hour less than 160 mg per deciliter. Then after 2 hour glucose loading, normal person less than 140 mg per deciliter. These criteria for diagnostic diabetic more than more than 200 mg per deciliter. The criteria for diagnostic impaired glucose tolerance 140 to 199 mg per deciliter. Diagnostic criteria for diabetes mellitus in fasting plasma glucose is more than 126 126 mg per deciliter, more than one occasion, and 2 hours glucose sample showing more than 200 mg per deciliter, then it is considered as diabetes mellitus. So 2 hours glucose sample showing more than 200 mg deciliter considered as diabetes mellitus. Then the random blood glucose level is more than 200 mg per deciliter on 2 occasion. Okay, random blood glucose level more than 200 mg deciliter on 2 occasion, or HbA1c is more than 6.5 percentage. Then these graphs showing the curve of normal impaired glucose tolerance in diabetes mellitus of oral glucose tolerant test, that renal threshold 180, normal person venous normal 70 to 110 mg, post glucose load, okay, after 2 hours 110 to 140 mg, random 70 to 140. So in this one, first we will see impaired glucose tolerance. Okay, this one, fasting more than 110 mg per deciliter but less than 126 mg per deciliter, 2 hours sample showing 140, 2 hours samples showing 140 mg per deciliter, less than 200 mg per deciliter. Diabetes mellitus is called as IGT, impaired glucose tolerance. So IGT means impaired glucose tolerance condition only, diabetes mellitus condition. So here more than, okay, this condition more than 140, okay, more than 140, here it is started more than 140, considered as diabetic mellitus condition. So in this video we'll discuss the oral glucose tolerant test. These are the symptoms we want to check blood glucose level. Then how to prepare our patient. Mainly 8-hour fasting is important one. Then next day morning we given that 75 gram glucose mixed with 300 ml water, drink 5 minutes. In the case of children means 1.7 gram per kg of body weight. After 2 hours collected samples. Impaired glucose tolerance IGT is called diabetic mellitus criteria. So this one, normal 70 to 110, post glucose 110 to 140, diabetic mellitus condition more than 140.